the man who hopes to be North Carolina's next treasurer from the Democratic Party, Duke University professor, and former Obama administration economic advisor, Ronnie Chatterji. Mr. Chatterji, thanks for coming on to discuss the race.
Well, thank you for having me. I really appreciate it.
Well, we're focusing on down ballot races. Treasurer will be there. It's important if you work for the state, or you're a teacher, or you work for a public university. What brings you into the race? Why are you the best choice?
Well, my parents were state employees, and I think it is the most important job that no one's ever heard of. The treasurer manages the $100 billion pension fund for our state employees and the state health plan, which covers over 700,000 people in this state and manages all our state and local bonds, everything we build in North Carolina. You know, I'd always had a career being the man behind the woman or the man behind the man, writing policy memos and being a wonk, and some may call a nerd. But I decided this is a cycle where nerds need to step up and try to get involved more deeply in public service. And so when I announced my campaign, we got it rolling.
Very well. Well, I want to ask you about, I've read your platform, read what you've said. I cut and paste a few things, so I'm not plagiarizing you, but I do want to say you would lead the fight to protect our environment, increase equity, expand access to financial services. That's a treasurer's job. Make healthcare a model for America. The treasurer can do so much for our state. Historically, that's a money job, but you're talking environment, equity, healthcare systems. How do you make that work from that particular position?
Thanks for asking. So one is on the healthcare side. The treasurer manages the state health plan, which essentially makes him or her the largest payer of healthcare in North Carolina. You're paying for healthcare across all 100 counties on behalf of our state employees. And so the decisions you make as a treasurer in terms of how you pay for healthcare and the value we get for your healthcare dollar, they can have reverberations all around North Carolina and the entire country. On climate change and financial inclusion, it's through our pension fund. You know, when you got $100 billion of investable assets, you got 100 billion votes on the way the economy works and who it works for. And that means you can have a say on how companies address climate change, how they think about diversity and inclusion on their boards, and whether they expand economic opportunity for everyone, not just the chosen few.
Retirees want returns, though, Mr. Chatterji. Can you balance those two? Because you know what's going to happen. You make a statement with state dollars on behalf of retirees, and the returns aren't what they are perceived to be. You're taking a beating for that. How do you explain that position?
Well, see, here's the thing. It shouldn't be about political statements. We have a politician in the job. We need a nerd. When you think about an investment, if you're not considering the impact of climate change on your investments, you're not investing correctly. Right now, we're flying blind, not thinking about these other factors and how they might impact our investment portfolio. Think about it like this. My folks, being public employees, I don't want them to have their money invested in a company that's going to have stranded assets 10 years from now, or going to face regulatory fines and penalties because they didn't plan for climate change. And so I think these things are actually win-win for the people of North Carolina and our state employees.
Who would you avoid investing in if you become state treasurer?
I don't think we should have any litmus test or rules. We need to engage with the companies we invest in and try to make them be better stewards of our money. So to me, blanket assessments like that don't make sense on the way in, especially with markets being so unpredictable and turbulent right now.
All right, let's talk about the state health plan. That's a big one, affects hundreds and hundreds of thousands of people in North Carolina. How do you assess the status of it? What's your vision for it if you take office 2021?
Thank you. I think the state health plan is going in the wrong direction. The current treasurer has proposed a plan. This is the second time now that's really failed. It's called the Clear Pricing Project, and it sounds good, but that's about the only good thing about it. He's trying to benchmark the prices to the Medicare standard. Here's the thing. None of the hospitals in the state signed up for this plan, and that means if you're a state employee, you're going to be out of network at these hospitals that have not signed up to his plan. And so we're going through the same exercise again. We need a fresh start. First, we need to get everyone together around the table, all the stakeholders in healthcare in North Carolina. We need to expand Medicaid, which is going to help the finances of our hospitals and our patients all across the state. And we need to start aligning the billions of dollars we pay with actual healthcare outcomes, not just doubling down on this 20th century model of fee-for-service. Those are all things we're going to do starting January 2021.
How are you going to make hospitals do something they may not want to do? And I know as treasurer, you cannot expand Medicaid. That's a whole different battle legislatively, as you well know. Influence with the hospital groups, how do you bring them along? Because if you're bringing down cost, revenues may be affected negatively in certain hospital campuses.
Sure. This is why you have to think about paying for value. We all want a contract that keeps hospitals accountable. The question is, accountable for what? For me, I want it to be accountable for value and outcomes. And this is a contract I think a lot of our health systems want to sign. Why do I know that? They've already signed it with Medicare, with Blue Cross Blue Shield. We're the biggest payer left out, not aligning how much we pay with the value we get. It's like Christmas presents that I buy for the kids, okay? I don't just shop on price. I look at the stars on Amazon too. Healthcare is one of the only things the state isn't looking at the stars. We're just looking at price, and that's a deal I think the health systems and patients are going to benefit from.
You think hospitals deserve more reimbursement out of the state health plan, less reimbursement? Explain that issue just a little further.
Sure. I think we should pay our providers more when they deliver better quality outcomes. That is the key. Right now, we're trying to basically get the price as low as we can for no matter whatever they're doing, regardless of whether you get healthier or not. That doesn't make any sense. In what industry do you pay not knowing what the value of the good you get is? Healthcare needs to be aligned where we pay more when we get more. And if we're not getting results and we're not getting performance, that's where an active state treasurer is going to have something to say to our hospitals and anyone else.
Where do these rural hospitals and rural independent physicians fall in under your platform?
Sure. So rural hospitals and health systems are in a precarious place, partly because we haven't expanded Medicaid, and partly because the current treasurer and their reimbursement scheme is going to put a lot of these hospitals out of business. We've already lost 5 rural hospitals since 2010. I don't want a single one to go down under my watch. And that means we're going to find a way to increase the reimbursements for primary care and behavioral health to our rural hospitals. We're going to have to do something different for rural hospitals under the state health plan than we are for a lot of others. But the current situation is untenable, and you see our hospitals, a large percentage of rural ones have negative margins in North Carolina. That's a really bad sign, and the current treasurer, we need to do something about that.
Tie that vision back to representing state workers and public school teachers, because these things can be expensive. You're going to reach into someone's pocket to get that money out and give it to fund these hospital efforts in your vision. What do you say to workers?
So for workers, these are the folks who are accessing the health care. When my mom or dad goes to the hospital, they're the ones who are going to get the valuable care in return. And if we keep people healthier and keep them out of the hospital, we will save money. That's what we've learned from healthcare over the last 20 years. North Carolina State Health Plan hasn't brought these into the way we manage it. If I'm treasurer, we'll have the most innovative practices, and we're going to make sure we save money and increase healthcare outcomes. It can be done. Hospitals are already doing it. The state health plan just isn't part of it.
The other huge tentpole program, the retirement system. You studied it. What do you make of it in 2020?
Well, the problem is, and you saw this in the recent results, we've lost billions of dollars over the last 4 years. The reason is the current treasurer has kept $10 to $11 billion on the sidelines underneath the mattress. That's not being sort of risk averse or being conservative. That's not putting our money to work. We could have made about $3 billion, according to my back of the envelope calculations, if we had had that money invested in a broad-based, diversified portfolio. We ought to have an investment strategy that makes sense, and we ought to have a permanent chief investment officer, a nonpartisan person with a lot of experience who's helping the elected official invest the money. We don't have that right now, and that's why with a politician in the office, we're not getting the results that we deserve.
So you would hire a new officer to oversee all investments under your watch, but
a permanent chief investment officer to work with me. I got a PhD, but I don't have all the answers. I need to work with someone who's worked in the markets, who's a nonpartisan person, who's appointed for their experience. We don't have a permanent chief investment officer now, and that's why we're flying blind right now in the retirement system.
One of the big issues of 2016, of course, was bringing a lot of that investment management back in-house in North Carolina, hiring internal experts under what would be your team. Was that a good move to bring the talent inside the treasurer's office and save on fees? Well, they call it Wall Street fees.
Sure. So 2 different things. One is I think it's great when managers aren't performing, bring it in-house if we can do it better and save money. I love to save money. All right. If you think about my own investments, I use Vanguard because I don't want to pay expensive brokerage fees. However, if you're saving money by holding it in cash, those fees are not doing good for North Carolina. It's like not changing your oil for 2 years and saying you save money. Well, I got news for you. The engine is going to have a big trouble. And that's what's going to happen here with our state retirement system because we've been holding all that money in cash. So I'm all for thinking about fees. We have to think about returns net of fees, and we can't just be saving money in the short term to lose a whole bunch in the long term. And that's what's been happening.
Well, look forward, 2021 through 24 would be Treasurer Chatterji's administration. It's easy to look back because your opponent in 4 years will beat you up over your returns too. Sure. What do you expect out of our state and national economy heading forward?
I think our state economy is going to recover and our national economy will recover over that period. How quickly we do it, though, does depend on federal and state actions. On the federal side, will you see aid to state and local governments? We have billion-dollar holes in our state and local governments. The mistakes we made in 2010 and 11 is we didn't invest in state and local government where 1 out of 12 people in America work. If we continue to starve state and local governments of that aid that's from no fault of their own due to coronavirus shortfalls, we're going to have a deeper and longer recession. If we do what's right and actually get money to our state and local governments, we can have a recovery here in North Carolina and across the country. That's going to be good for markets, but more importantly, good for people.
Well, for now, there will be no stimulus or anything coming in as of right now, at least anything more than the CARES Act that passed, you could inherit a situation with huge deficits.
Yes.
You know, the rose wilts on the economic picture, if you have that. Take us through that scenario. You walk in, the economy's in bad shape.
Great point. If that aid doesn't come, our state officials will have to make really hard decisions about how to balance our budgets. For the state treasurer's office, I'm going to be keeping in touch with the markets, figuring out how to invest our money. Even in difficult economic times, there are opportunities for North Carolina. It could be in equities, it could be in bonds, it could be in real estate. That's why you need a great world-class team and a chief investment officer to make sure you don't miss those opportunities like we've been missing them in the last 3 or 4 years. Secondly, I still think we should expand Medicaid. With so many people out of work, people are not going to have their health insurance. And so if we don't have Medicaid, people are going to be less healthy and less able to contribute in the workforce. These are all things we can do in North Carolina during that time. The state treasurer can advocate for Medicaid expansion to the General Assembly.
Let me ask you about your personal experience. You worked in the White House. You've advised the president on economic matters. What is that like compared to what you think being a treasurer would be like and recommending policies to state leaders?
Good question. I mean, it was a thrill and honor to advise a president. I think no matter your political party, to work in the White House is an honor. I happen to believe in the person I was working for quite a bit, and that made it all the better. When it comes to states, though, a lot of the federal policy gets kicked down to the state and local, and there's an assumption that we're just going to figure it out. Well, we don't always have the capacity or the resources to do that. So there's a lot of stuff being kicked down the road for states and locals to figure it out. It's going to be much harder as a state official to make sense of this complicated environment. It's easy to propose things. It's harder to do them. And that's why the state treasurer, I'm going to have a team in the department of about 400 people who are experts in their fields, who I'm going to treat like professionals, and we're going to get the job done. But I expect it to be a much harder job than what I had in the White House.
Last 30 seconds. Can you work with Republicans? Medicaid expansion. You've hit on some real red meat topics that have been part of the state races before. Sure. Can you cross the aisle?
I definitely can. I mean, when I go around North Carolina, I feel that people are concerned about their health systems and the jobs associated with them. Go out to Eastern North Carolina, where the biggest employer is Vidant. Go out to Western North Carolina, where the biggest employer is Mission. These are folks who understand the impact of healthcare access and affordability and jobs in their communities, and that's why they're supporting me for treasurer. When I am elected, I definitely want to work with as many people as I can from the Democratic side and the Republican side. You can't get things done in North Carolina otherwise. So I expect to be able to do that. The treasurer can play a nonpartisan and technocratic role in a lot of discussions.
Voters, this is Ronnie Chatterji, Democratic nominee for North Carolina Treasurer. He's on your election 2020 ballot in North Carolina. Mr. Chatterji, thanks for appearing and thanks for this conversation.
Thank you.